Hi, this is Dr. Kadam Nagpal, Senior Consultant Neurologist from PSRI Hospital. So I'm here to sensitize about what exactly is stroke, what are the early signs, what are the remedial measures, and how can strokes be prevented, and who are the population at risk for strokes. So stroke is basically in Latin, the word comes from where it implies that struck by the hand of God. So stroke is being classified into three types. So one is basically once there is a clot inside the blood vessel, which we call it as ischemic stroke or infarct, and another is when there is a rupture of the blood vessel, which we call it as a hemorrhagic stroke or bleeding inside the brain. The third type of stroke, what we call it as a mini stroke or a transient ischemic attack, is stroke. When it happens, it is transient. The symptoms are present, which spontaneously get resolved over a couple of minutes to couple of hours, but it's basically a warning sign of an impending stroke. That is why the treatment of a mini stroke is similar to that of a ischemic stroke. So usually what we see that around 170 patients will be affected in a population of 1 lakh every year. So this is the burden of stroke what we see in India, and basically this is the tip of the iceberg, because we don't have a proper stroke registry, so the numbers might be underestimated. The risk factors for stroke is basically lifestyle factors are there, advancing age, hypertension, diabetes, abnormal cholesterol levels, smoking, excessive alcohol intake, increased weight, and whatever might be the lifestyle related risk factors, they're all encompassed in result in a ischemic stroke. So similarly, the treatment options what we suggest to our patients is that they should be, first of all, be aware of what the signs and symptoms are. We let them know about a mnemonic like B fast. So B is any problem in the balance. E is for eye signs, any abnormal eye signs or loss of vision. F means any kind of a facial droop. A is for arm deviation or arm weakness. S is for any kind of slurred speech. So whenever we have any symptoms, this is the time to act. So B fast, B for balance, E for eye signs, F for facial droop, A for arm drop, S for slurred speech, and T is for this is the time to act. So immediately take such patient to any nearby facility, wherever a neurology facility or a stroke unit is. Then subsequently, these are the patients who are immediately subjected to scanning in order to look for what exactly is the stroke, what is the pathology, what is the disease inside the brain. It is being ascertained using a CT scan followed by a MRI followed by a CT angiography of the brain. Then subsequently, if the patient is there in first 3 to 4.5 hours, what we call it as golden hour in ischemic stroke, immediately a clot burst medication is being given through an injection, and this is often being used either alone or in conjunction with mechanical clot retrieval that is done through an intervention. So beyond 4.5 hours or whenever the golden hour has elapsed, patients are being stabilized in the ICU so that the blood pressure and the sugar are being very stringently controlled, and they are being put upon blood thinners and neuroprotective medications. Simultaneously, we put these patients through aggressive neurorehabilitation and physiotherapy modules so that rehabilitation can be considered at the earliest in order to reduce the disability of the stroke. So these are the common signs. This is the common modality of treatment. We often ask our patients that they can prevent a stroke in happening. They need to be just taking their blood thinners regularly. They need to keep their blood pressure in control. Sugars need to be controlled by a diabetologist. They should be following it through a diabetologist very regularly so that they can put their blood sugar levels in an appropriate range. Their cholesterol should be well maintained. They should resume their physical activity. Their regular exercises should be resumed, and excessive weight gain, smoking, and alcohol should all be avoided. So when these kind of risk factors are being taken care of, there is always a chance that we might be able to curtail any kind of strokes in the future. So we often let our patients know that time is brain. Whenever these kind of symptoms happen, they have to rush towards the hospital setup, and they have to just follow it up with the neurologist in a stroke unit wherever the stroke facilities are available. Thank you.